So, a vasectomy, it's often seen as, the final step, a permanent decision. But what happens if you change your mind? Well, today we're going to dive right into that. Can you still build a family after a vasectomy? We'll break down the science, the whole process, and what the real chances of success look like.
Hey, life happens, right? Maybe things have changed, you've met someone new, or you've just had a change of heart. So if you've had a vasectomy and are now dreaming about a baby, you're probably asking yourself, is it even possible?
Well, let me just give you the short answer right up front. Yes, a huge resounding yes. A decision you made in the past doesn't have to lock the door on your future family. The path might look a little different now, but it is absolutely there. So let's get into exactly how this amazing journey can work.
Okay, first things first. To really get this, we need to understand what a vasectomy actually does, and maybe more importantly, what it doesn't do. Busting a few myths here is going to be key.
All right, so a vasectomy is actually a really straightforward procedure. Its only job is to block the vas deferens. You can think of those as the little highways that sperm use to get from the testicles out into the world. All the surgery does is put up a roadblock on that highway.
So let's really separate the myths from the reality here. A vasectomy, it just blocks the path for sperm. That's it. The really critical part to understand is what it doesn't do. It doesn't stop sperm production, it doesn't mess with testosterone levels, and it has absolutely no impact on sexual function or desire.
And this is the really good news, okay? The sperm factory, it's still open for business. It's fully operational. Production just keeps on going like it always has. The only difference is the sperm can't get out, so they just get safely and naturally reabsorbed by the body. And that, right there, is fantastic news when you're thinking about future fertility.
Okay, so if the main highway is closed, the big question is, how do we get the goods? How do we get that sperm out? And that brings us to the next really important step, sperm retrieval.
Since the natural path is blocked, we basically need a workaround, and that workaround is a simple procedure called surgical sperm retrieval, or SSR. We're pretty much just going directly to the source to collect what we need. It's that straightforward.
So there are a few ways to do this. The most common are called PESA and TESA. Both use a really fine needle to get sperm either from the epididymis, that's where sperm go to mature, or directly from the testicle itself. There's another one called TESE, which involves taking a tiny little tissue sample. The main thing to know is that all of these are designed to be minimally invasive, with a pretty quick recovery.
All right, so we've got the sperm. What's next? Well, now we head to the lab, and this is where the real magic happens. We're diving into the world of IVF and a super powerful technique called ICSI.
ICSI is a total game changer in this process. It stands for intracytoplasmic sperm injection, which I know is a mouthful. It's really just a fancy way of saying that an embryologist picks out one single healthy sperm and, with amazing precision, injects it right into an egg. This completely bypasses any issues the sperm might have trying to fertilize the egg on its own.
So let's walk through the whole thing step by step. First, eggs are retrieved from the female partner. Usually on the same day, we get the sperm from the male partner. Then, in the lab, those eggs get fertilized using that cool ICSI technique we just mentioned. From there, the new embryos grow for about 5 or 6 days until they become what's called a blastocyst. And finally, a healthy embryo is transferred into the uterus. So after that whole process, what can you realistically expect? Well, on average, a single IVF cycle might give you somewhere between 2 to 6 transferable embryos. Now, of course, this is different for every single person, but it gives you a pretty good ballpark figure to think about.
All right, now for the question that's probably on everyone's mind. What are the chances this will actually work? Let's break down the key things that really determine success on this path to parenthood. Success here really is a team effort, and there are a bunch of different factors that play a role. A huge one is the female partner's age, because that's directly linked to egg quality, but also the quality of the sperm we retrieve, the quality of the embryo that's created, the health of the uterus, and, of course, the expertise of the fertility clinic and their lab. They're all really crucial pieces of the puzzle.
And this chart really paints a clear picture of why the woman's age is such a big factor. If you look at women under 35, the live birth rate for one cycle is about 35%. And as you can see, that number does naturally go down with age. This is just super important to know when you're setting your expectations.
But, and this is a really, really important point, it's so easy to get hung up on the numbers for just one cycle. But the story doesn't end there.
The real power, the real hope, is in looking at the cumulative chance of success over multiple attempts.
So what does that cumulative success actually look like? Well, for cases that are considered favorable, the success rate after doing 1-3 cycles can jump all the way up to 60 to 80%. Now that is a really encouraging and hopeful number.
Okay, here's the question we get all the time. What if it's been a long time since the vasectomy? Like 10, 15, even 20 years. Does that hurt your chances?
And the answer is not necessarily. Look, while the sperm quality might decline a bit over a long period, that's exactly what powerful techniques like ICSI are designed to overcome. The bottom line is, as long as your doctor can find viable sperm, which they usually can, these success rates actually stay pretty stable. It's amazing, really.
When you boil it all down, what this really means is that a decision you made in the past, for reasons that were totally valid for you at that time, it doesn't have to define the family you dream of having in the future.
We really hope this has been an informative and, most of all, an empowering overview for you. Now, it's super important to remember, this is all for educational purposes, okay? This is not medical advice. You absolutely need to talk to a doctor or a fertility specialist about your own personal situation.
And if you want to learn more about the entire IVF process, from A to Z, you can find a ton of great information over at the portal ivfforme.com.
We just want to wish you the absolute best on your journey. It's just such a powerful reminder that even when some doors seem closed for good, science and hope can come together to build a brand new one. Thanks so much for joining us.